everyone, welcome to my YouTube channel Ambitious Dr. Ashwini, and today we will see the next protozoa, that is Toxoplasma gondii. So Toxoplasma gondii comes under Sporozoa. You can see Toxoplasma comes under Sporozoa. So the contents today we will see: describe the mode of transmission of Toxoplasma gondii, describe the pathogenesis of Toxoplasma gondii, describe the clinical features of toxoplasmosis, and describe the laboratory diagnosis of toxoplasmosis. Firstly, we will see the introduction. Toxoplasma gondii is a tiny parasite that can live only inside the cells of living things. It infects many animals and birds and also humans. Most people who get infected don't fall sick because their immune system keeps the parasite under control. But in people with weak immunity, like those having HIV or AIDS, the parasite can become active again and infect the brain, causing encephalitis. If the pregnant woman gets infected, it can pass to her baby, leading to congenital infection, which can be dangerous. So, in short, Toxoplasma gondii infects many animals and humans. It usually stays silent but can cause brain disease in immunocompromised persons and infection in the fetus during pregnancy. This is the structure of Toxoplasma gondii. Now we will see the morphology. Toxoplasma gondii appears in three different forms during its life cycle, that is tachyozoid, tissue cyst and oocyst. So tachyozoid, it is crescent shaped, about 4 to 8 micrometer long, active and fast multiplying form like tropozoid, found during acute infection, which is seen in blood. Now tissue cyst, it is resting stage of the parasite, seen in chronic infection, found in muscles and brain. Size varies from 2 to 100 micrometer, contains many bradiozoids, crescent shape, slowly multiplying forms with pars positive granules. Next, oocyst, the sexual form found in cats and other felines. Definitive host, oval shaped, about 11 to 14 micrometer length, has two sporocysts, each with 4 sporozoids. In short, Toxoplasma gondii exist as tachyzoids, which is acute stage, tissue cyst, which is a chronic stage, and oocyst in cats for transmission. You can see tachyzoids. These are the tachyzoids. These are the bradiozoids which are in the tissue cyst, and these are the sporocyst, two sporocyst consisting of each one consisting of 4 sporozoids, which is oocyst. Now we will see the mode of transmission of Toxoplasma gondii. Toxoplasma gondii has a two-host life cycle and can infect humans through different routes. The hosts are definitive host and intermediate host. Definitive hosts are cats and other felines. Cats and cat-like animal, which means felines. The sexual cycle occurs in their intestines. Next, intermediate host, they are humans and other mammals. Other mammals like rodents, mice, rats, squirrels, small chewing animals. The sexual cycle occurs in their tissues. Firstly, we will see the human asexual cycle, the transmission. Toxoplasma gondii is special because all three forms, that is tachyzoid, bradyzoid, and oocyst, can infect humans. Infection occurs mainly by eating undercooked meat containing tissue cysts, which is most common, swallowing oocysts from contaminated soil, food, or water, then blood transfusion, organ transplant, or mother to baby transmission via tachyzoids. Transformation inside the body. In the intestine, sporozoids from oocysts or bradyzoids from tissue cysts are released. They invade intestinal cells and turn into tachyzoids, which is active multiplying form. Tachyzoids spread through the blood to organs like the brain, muscles, eyes, and liver, where they change into bradyzoids and from tissue cysts, which is the chronic stage. Now we will see the sexual cycle, that is feline cycle. Cats get infected by eating rodents that contain tissue cysts. In the cat's intestine, bradyzoids are released and undergo schizogony, which is asexual multiplication, and gametogony, which is sexual stage, forming male and female gametes. These gametes fuse to make zygotes, which develop into oocysts. Oocysts are passed in cat feces, and after a few days in the humid environment, they sporulate and become infectious to humans. So, in short, Toxoplasma gondii completes its sexual cycle in cats and asexual cycle in humans and other animals. Humans get infected mainly by eating undercooked meat, contaminated food or water, or mother to baby transmission. This is the life cycle. Man, rodent or other mammals acquires infection by several routes. That is from tracheocyte or directly mother to fetus or from tissue cyst. Now we will see the life cycle. Man acquires infection by several routes. Excision in intestine happens. Here sporozoites or badizoids released, then invade intestine and releases tachyzoid. Here endodo- here endogony happens, spreads to mesenteric lymph nodes, and from here directly from mother to fetus. Then spreads to extraintestinal organs like brain, muscles or eye. Transfers to Bradiozoids. From here, Bradiozoids releases tissue cyst and ingestion of rodent meat. Here, the rodent meat ingests this tissue cyst and cats acquire infection by eating the rodent meat. Then, Bradiozoids releases in intestine male and female gametocytes. Here, forming male and female gametes, fertilization happens and zygote is released forming. Then unsporulated oocyst in cat feces. In environment it gets sporulated oocyst and this sporulated oocyst acquires infection through the several route to the man. Now we will see the pathogenesis of Toxoplasma gondii. So toxoplasmosis is a zoonotic, that is animal to human parasitic infection caused by a Toxoplasma gondii. It infects many mammals and birds including humans. Global prevalence is about 25 to 30% of people worldwide are infected. In India and Southeast Asia, the infection rate is low, that is 10 to 30%. Risk factors for infection. Immune status. People with people with weak immunity, such as those with HIV or AIDS, cancer, or undergoing blood transfusion or organ transplant, are at higher risk. Age commonly affects the elderly and fetuses, can cause congenital toxoplasmosis. Food habits. Eating raw or undercooked meat, especially from cats or other animals, increases the risk. It is seen more in countries like France. Genetic factors. Certain genes like HLA-DQ3 are linked to encephalitis in AIDS patients and hydrocephalus in infected fetuses. In short, toxoplasmosis affects many animals and humans worldwide. Risk increases with weak immunity, old age, or fetal exposure, raw meat consumption, and certain genetic factors. Now we will see the clinical features of toxoplasmosis. The symptoms of toxoplasmosis depends on the type of person infected. First one, immunocompetent host, that is healthy person. Usually no symptoms. The infection is asymptomatic and self-limiting. Rarely may develop acute toxoplasmosis with lymph node swelling, that is especially neck or back of the neck. Then headache, fever, tiredness and malaise, which is feeling of unwell. Next is immunocompromised host, that is HIV patients, cancer patients or organ transplant recipients. Infection becomes severe because their immune system is weak. Common manifestations: encephalitis, that is inflammation of the brain. Other sides: lungs, that is pulmonary infection. And eyes: chorioretinitis, that is inflammation of the choroid and retina. Choroid are the blood vessels. Toxoplasmosis in HIV patients. One of the most common opportunistic infections in AIDS, 15 to 40%. Infection occurs due to reactivation of old dormant infection, which is most common, or a new infection from blood transfusion or organ transplant. Main symptom: Toxoplasma encephalitis, that is TE, causes headache, confusion, seizures, and or coma. The fourth one is congenital toxoplasmosis. Occurs when infection passes from mother to fetus through the placenta. Can cause serious birth defects such as chorioretinitis, which is the eye infection, then hydrocephalus, which is fluid in the brain, and intracranial calcification, which is calcium deposition in the brain. So, in short, toxoplasmosis is usually mild in healthy people but can cause brain and eye infection in immunocompromised patients and serious birth defects in fetuses when transmitted congenitally. Now we will see the laboratory diagnosis of toxoplasmosis. So, diagnosis of toxoplasmosis is done by microscopy, which is seeing parasite, then antibody tests, IgM or IgG, and PCR, which is detecting DNA. So, this was all about toxoplasmosis, and we have seen here Toxoplasma gondii. So please like, share and subscribe to my YouTube channel, and don't forget to press the bell icon for latest updates. Thank you.